Hi, my name is Dee Watts, and I work for the New Hampshire Citizens Health Initiative out of the University of New Hampshire's Institute for Health Policy and Practice. In my role as a practice facilitator, I work with a variety of healthcare providers around the state, helping them with quality improvement. And when we first went with the pandemic and there was the stay-at-home orders, one of the things that I did a lot of work on was helping providers to share information with their patients on how to make telehealth visits successful. I'm going to share a little bit of that information with you today. So the purpose of this presentation is to help you understand what to expect and how to feel prepared for a successful telehealth visit with a medical provider. So today we're going to talk about setting the stage for your visit and how you can be prepared, and knowing what information that you want to have ready for that visit and how to collect that information accurately. So one of the first things I wanted to explain was that unfortunately there are a variety of telehealth platforms and software that providers can choose from. So it doesn't necessarily mean that you may have different providers and they may use different software. But one thing that you probably won't see is Skype or FaceTime. I know that this is something that you may have a lot more experience with communicating and talking with family and friends over this last year, but it's not HIPAA compliant, so it doesn't protect privacy the way the regulations say we have to. So let's talk about protecting your privacy, because even during telehealth visits, this is something that's very important and it has to be respected, and there's still rules and regulations around it. So some of the things that you can do to help your provider protect your privacy are to find a quiet location where you can speak freely and you can hear what your provider has to say, but still have it be private. The best solution is to try to find a room where you can go in and you can shut some doors and have it be nice and quiet. If that's not an option, you can try using headphones, because that will help your provider to hear you better. It will also help shut out some of the background noise so that you can hear what your provider has to say. Another option is to make appointments during quiet times, like not maybe during dinner, or if you're expecting company, if you have people over, it's better to try to schedule your appointments during times when it's going to be as quiet as possible. However, if for some reason none of these work and you're not able to have a private appointment, it's really important that you let your provider know that, so that they can take steps to protect your privacy on their end. At the same time, it's really a good idea to let your provider know if you are allowing a spouse or a child to participate in your telehealth visit. So just let them know ahead of time that there will be other people there. So let's talk about setting the stage for a telehealth visit and how we can help to have this as successful as possible. So we talked about protecting your privacy, and now we want to talk about being prepared with your device. So if you're going to use a phone or a tablet or a computer, make sure that it's fully charged, or even better yet, have it plugged in for the whole duration of the visit. That way you don't have to worry about running out of charge in the middle. Another thing is to check your lighting. Make sure that you can be seen well and that you're able to see, there's not a lot of glare on your screen, so that you can see your provider as well. This is something that you can do it using FaceTime or Skype in advance. You can sort of sit down and call somebody and have them tell you if they can see you, and then you'll be able to also know if you can see them clearly. And that also goes for checking your volume. Doing this in advance is really helpful. You want to make sure that the sound is up so that you can hear. You also want to know where your mute button is in case you do need to have it quiet for a minute, or you need to unmute to make sure that you can say something. talk about aiming your camera. So let's do this as Goldilocks, okay? We want it to be just right. We don't want it to be too far. We don't want it to be too close. We just want it to be exactly in a good space where you can see your face clearly, but it's not crowding the screen or crowding the camera. The other thing to take into consideration, if you have something that you want to show your provider, you might want to make sure that you can aim your camera if you have a rash or a lesion or something that you want to be able to show somebody. So being able to aim your camera is really important in making, helping with the success of a telehealth visit. So now let's talk about what you want to have ready in advance. And the first thing you want to have is a list of all your medications. This includes your over-the-counter medications and any prescriptions that you're currently taking. Another thing that you want to have is a list of your questions. You want to have it take a few minutes and write these out ahead of time so that you're not trying to remember what you wanted to ask the provider, because a lot of times other questions will come up in the visit and you want to be able to ask those at the moment. So have your questions that you know you want to ask prepared in advance. Another thing to have is a list of any home monitored results. This would include blood pressures, blood sugar, weight, temperature. And when you go into a doctor's office, the nurse or the medical assistant will take a lot of this information as vitals, and you're not going into the visit, so you are into the doctor's office for a visit. So you have to try to have as much of this at home as possible. So we're going to take a couple of minutes to talk about how you can make sure that some of these results are as accurate as possible. We're not going to talk about blood sugars because typically if you're taking blood sugars at home, you've either had maybe a diabetes educator or nurse show you how to do that and to get those accurate results. But a lot of things like temperatures and weights and blood pressures, you take those using over the counter or things that you've picked up at the pharmacy. So, but they still can be accurate, or you still can improve the accuracy if you follow a couple of tips and hints. And I'm going to share those with you now. We're going to start with blood pressure. And I've got 5 tips for taking an accurate blood pressure at home that will help you. So the first tip is to relax for a couple of minutes. Sit quietly. You don't want to have just run in from outside or up or downstairs. You want to have a nice, quiet 5 minutes of relaxation before you even try to take your blood pressure. And then you want to sit up nice and straight in a chair with 2 feet on the floor and your back supported. You don't want to cross your legs or your ankles. You want to just sit up in a nice, straight, relaxed position. And then you want to take the cuff and you want to have it directly on the skin. So if you're using an arm cuff, have a t-shirt on or try to push your sleeve out of the way. You want to make sure that the cuff is directly on the skin. If you're doing a wrist blood pressure, you want to put your elbow on the table and put your hand over your heart and have it be nice and supported and sit in a quietly while you're taking your blood pressure. If you're doing an arm cuff, again, you want to have your arm on a nice hard surface and have it fully supported. And just a quick reminder, you want to be quiet and not talk at all while you're having your blood pressure taken. Even if you have one of those automatic inflation devices, you don't want to talk. You want to sit nice and quiet. And then really important, write it down. Write down the date and the time and the results. You don't want to have to try to remember at the last minute if your doctor asks you for these results. So now let's take a couple of minutes and we'll talk about a couple of tips for accurate weight. So I have 4 quick tips for this. The first one is to take your weight at the same time each day. That way you are, you can take it first thing in the morning if you want, or you can take it in the evening, but you do want to have it at the same time. And then you want to use the same scale, and you want to have it in the same location. Try to have it on a nice solid floor so that there's accuracy. That'll improve the accuracy, but you do want to use the same scale each time. And then you want to wear the same type of clothing. Clothes can weigh anything from 2 to 4 pounds. So if you are dressed when you're taking your weight, just make sure that you're wearing the same type of clothing, and at least try to take off your shoes and be consistent with that. And then again, write it down, and you want to write down the date, the time, and the results so that when your provider asks, you'll have that information available. Now let's talk quickly about accurate temperatures. So there's 3 tips for temperatures. The first tip is use the same type of thermometer. There's 2 types of thermometer. You have touch thermometer or contact thermometers. Those are the ones that you use under your tongue or maybe in your armpit. And then you have infrared or remote thermometers, which you use for your ear and your forehead. And these, you want to take your temperature on the same location. So if you are using the temperature and you're taking it in your ear, take it in your ear each time. Or if you're doing it on your forehead, again, use the same thing. It's consistent that way. It's important that you, when you write this down, it is important that you include the location of where you took your temperature, because there can be as much as 2 degrees difference between taking your temperature in an ear and taking your temperature on a forehead. There's one other tip here. Those thermometer strips or temperature strips that they put across foreheads, if that's all you have, then of course use that, but they're just not as accurate as the other 2 thermometers that we talked about here. So again, write it down. Like I mentioned, that's really important. So I really want to thank you for giving me a couple of minutes to explain some of this with you and share some of these tips and hints that we collected along the way. And I hope that they will help you in making your next telehealth visit very successful. And I've appreciated this opportunity. Thank you again. And here are a couple of links to some resources that I hope you will find helpful. It's very much just the same information that we shared here, but it's something that you can print out and have for yourself. Thank you again, and have a good day, everyone.